Welcome
Welcome to
to
Healthy
today's
Care,
video
your
about
trusted
symptoms of
source for
pneumonia.
essential.
Welcome back. Today we're talking about the symptoms of pneumonia. That nagging cough, the chills, or a fever that comes out of nowhere might feel like a routine cold, but sometimes it's something far more serious. Recent global estimates suggest pneumonia is linked to roughly 2.5 million deaths each year, including about 610,000 children under the age of 5. Pneumonia can affect anyone from young children to older adults, and catching it early can make a life-changing difference. The problem is that the warning signs aren't always dramatic at first. Do you know the quieter clues that can point to a dangerous lung infection? Stay with us as we break down the symptoms you should never brush off so you can act quickly. Get the right medical care and help protect the people you love. Let's get started. This video is for educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always speak with a qualified healthcare provider about any health concerns. The research shared in this video has been checked by researchers, and the full list of references can be found in the description below. Cough. Let's start with one of the most common and important pneumonia symptoms, a cough. When pneumonia develops, it irritates and inflames the tiny air sacs in the lungs, and those spaces can begin to fill with fluid or pus. Your body reacts by trying to clear the airways, and that protective response often shows up as coughing. With pneumonia, the cough is frequently productive, meaning it brings up mucus or phlegm. That mucus can look different from person to person, ranging from clear to yellow or green, and in some cases, it may even appear blood-tinged depending on the cause and severity of the infection. In 2021, a study published in the journal Sensors examined cough sound patterns in people with pneumonia. The researchers reported that pneumonia-related coughs tended to become louder toward the later part of the cough and showed sustained high-frequency components. These sound features may help separate pneumonia coughs from coughs linked to other illnesses. A cough that lasts longer than a week, especially if it comes with fever or shortness of breath, should not be ignored and deserves medical evaluation. Identifying pneumonia early and starting treatment promptly can reduce the risk of complications and help speed up recovery. High fever. Next is symptom number 2, high fever. Fever is a classic sign that your immune system is actively fighting an infection. When bacteria, viruses, or fungi enter the lungs, the body responds by increasing core temperature, creating conditions that are less friendly for many pathogens. That rise in temperature is what we experience as a fever. With pneumonia, fever isn't always the same for everyone. Some people develop only a mild temperature, while others can spike as high as 105 degrees Fahrenheit, 40.5 degrees Celsius, or even higher. Very high fevers are more often associated with bacterial pneumonia and may be paired with sweating chills and an overall sense of being unwell. Research also highlights how meaningful fever can be in recognizing pneumonia. A 2023 report in the American Journal of Medicine described cases in which fever and headaches were the only signs of pneumonia, showing that fever alone, even without obvious breathing symptoms, can sometimes be an early warning. It's also important to remember that certain groups, especially older adults, may not show a strong fever at all. Instead, they might appear confused or have a lower than normal body temperature, which can make pneumonia easier to miss when fever is absent. That's why keeping an eye on temperature changes matters, particularly if you're at higher risk. Ongoing fever or a very high temperature should prompt medical attention because early diagnosis and treatment can help prevent complications and support a smoother recovery. Shortness of breath. Now we come to symptom number 4, shortness of breath. Breathing is supposed to feel automatic, but when pneumonia affects the lungs, even simple breaths can start to feel like hard work. Pneumonia causes inflammation inside the tiny air sacs, and those spaces can become filled with fluid or pus. When that happens, oxygen has a harder time moving from the lungs into the bloodstream. As a result, the body has to compensate, and many people feel breathless even while sitting still. Healthy lungs expand easily for a deep inhale, but inflammation can make the lung tissue stiffer and less flexible. That stiffness limits airflow and can turn normal breathing into shallow, unsatisfying breaths. When oxygen levels drop, the brain senses the change and pushes the body to breathe faster. That's why someone with pneumonia may feel out of breath after very small efforts like walking across a room or climbing a few steps. A 2011 study published in Clinical Infectious Diseases reported that people with pneumonia often show noticeably lower oxygen saturation, with an average decline of about 8 to 12% compared with healthy individuals. This helps explain why breathlessness is commonly paired with dizziness and fatigue. In more serious cases, oxygen levels may fall so low that the lips or fingertips appear bluish, which is a dangerous sign. If shortness of breath is getting worse or happens along with chest pain, it should be treated as a medical emergency. Getting help early can reduce complications and support faster recovery. If your breathing suddenly feels unusual, don't dismiss it. Chest pain. Chest pain with pneumonia is fairly common and can feel frightening. One major reason is irritation of the pleura, the thin layers of tissue that cover the lungs and line the inside of the chest cavity. When the pleura becomes inflamed, each breath, cough, or sneeze can cause a sharp stabbing pain. This type of discomfort is often described as pleuritic chest pain. Chest pain can also appear when pneumonia leads to complications. In some cases, the infection extends into the pleural space and triggers a buildup of thick fluid made of fibrin and pus, sometimes described as a fibrinopurulent exudate. This can increase pressure and pain, and it may require urgent medical treatment. Pneumonia can also trigger inflammation throughout the body, not only in the lungs. That systemic response can affect the cardiovascular system and raise the risk of heart-related complications, including acute coronary syndromes, which can present as chest pain. In short, chest pain during pneumonia may come from pleural inflammation, the spread of infection into the pleural space with fluid accumulation, or even effects on the heart driven by a body-wide inflammatory response. Understanding these possibilities matters because prompt recognition and early treatment can make a critical difference. Chills. Chills can feel alarming, especially when they hit suddenly and show up alongside other warning signs. With pneumonia, chills often reflect your body's early fight against the germs causing the infection. When bacteria, viruses, or fungi invade the lungs, they irritate the tiny air sacs called alveoli. As inflammation builds, those air sacs may start filling with fluid or pus, which makes it harder for oxygen to pass into the bloodstream. To defend you, the immune system releases signaling chemicals known as cytokines. These cytokines can shift the temperature set point in the hypothalamus, pushing your body toward a higher temperature, what we recognize as fever. As that internal temperature climbs, you may begin to shiver. Those rapid muscle contractions and relaxations are your body's way of generating extra heat, and that's the sensation we call chills. A 2021 study published in Nature Review's Disease Primers reported that about 85% of patients diagnosed with bacterial pneumonia experienced chills early in the course of illness. This highlights how frequently chills can appear as one of the first noticeable symptoms. At the same time, chills are not guaranteed in every case. Age, overall health, and the specific organism involved can all influence which symptoms appear and how intense they feel. Older adults or people with weakened immune systems, for example, may not show classic signs like chills or even fever. If you or someone around you has ongoing chills along with other pneumonia symptoms such as cough, fever, or trouble breathing, it's important to seek medical care quickly. Early diagnosis and timely treatment can improve recovery and help prevent serious complications. Fatigue. Feeling deeply drained even after you've rested can be a meaningful warning sign of pneumonia. This heavy exhaustion often comes from the immune response itself. As your body fights the infection, it releases inflammatory cytokines, including interleukin-6 and tumor necrosis factor alpha. These chemicals help coordinate the defense against pathogens, but they can also leave you feeling unusually tired and depleted. A 2011 study in the European Respiratory Journal reported that people with community-acquired pneumonia showed higher levels of systemic cytokines, and those elevations were associated with greater fatigue. On top of that, Pneumonia can disrupt normal oxygen exchange in the lungs, lowering the amount of oxygen entering the blood. This reduced oxygen state, known as hypoxia, can intensify weakness and exhaustion because tissues and organs are not receiving the oxygen they need. The Cleveland Clinic notes that hypoxia may also involve confusion, restlessness, and a rapid heart rate, which can further worsen the sensation of fatigue. If persistent fatigue is happening along with respiratory symptoms, it's important to speak with a healthcare provider promptly, since early diagnosis and treatment of pneumonia can improve recovery and reduce complications. Rapid breathing. Breathing can feel scary, and in pneumonia, it often has a clear purpose. When pneumonia affects the lungs, the alveoli, the tiny air sacs responsible for gas exchange, become inflamed and may fill with fluid or pus. This makes it harder for oxygen to get into the bloodstream and for carbon dioxide to leave the body. To compensate, the body naturally increases breathing speed to pull in more oxygen and push out carbon dioxide more effectively. There's also a reflex component. Specialized nerve endings in the lungs, commonly referred to as juxtacapillary or J receptors, can sense changes such as fluid buildup. When they detect this congestion, they send signals to the brain that help drive an increased breathing rate. A 2017 reference in Principles and Practice of Pediatric Infectious Diseases noted that rapid breathing is often an early sign seen in pneumonia. Recognizing this pattern matters because noticing rapid breathing early can support faster evaluation and treatment. In simple terms, rapid breathing is one of the body's built-in responses to keep oxygen delivery to vital organs as steady as possible when lung function is impaired. Rapid heart rate. When you're fighting pneumonia, your body doesn't just respond in the lungs, it reacts throughout the entire system. The infection triggers inflammation in the airways and lung tissue, and that immune response releases substances such as cytokines into the bloodstream. These inflammatory signals can influence how the heart functions and may cause the heartbeat to speed up, a condition known as tachycardia. Fever also plays a major role. Because fever increases your metabolic rate, your body demands more energy and more oxygen. To keep up with that higher workload, the heart often pumps faster, which can make your pulse feel noticeably quicker than normal. At the same time, pneumonia can interfere with oxygen exchange, creating an imbalance between how much oxygen your body needs and how much it's actually receiving. To compensate, the heart may beat more rapidly in an effort to circulate oxygen more efficiently to vital organs. A 2012 study published in the journal Circulation reported that people with community-acquired pneumonia can experience cardiac complications, including tachycardia, and it emphasized the value of monitoring cardiovascular status during treatment to support better outcomes. Noticing and addressing a rapid heart rate during pneumonia matters. It reflects the body's response to infection, but it can also signal how much strain the illness is placing on the system. If someone with pneumonia has a persistently elevated heart rate, it's important to contact a healthcare professional so they can evaluate the situation and make sure both heart and lung health are being managed appropriately. Bluish lips or nails. Now, symptom number 9, bluish lips or nails. During pneumonia, some people may notice a blue or purplish tint around the lips or under the fingernails. This is called cyanosis, and it's a sign that these tissues are not receiving enough oxygenated blood. With pneumonia, the lung air sacs can become inflamed and fill with fluid or pus, which blocks oxygen from passing efficiently into the bloodstream. When oxygen levels fall, areas with strong blood flow and thin skin like the lips and nail beds may start to look bluish. The American Journal of Medicine has described cyanosis as occurring when oxygen saturation drops enough to increase the amount of deoxygenated hemoglobin circulating in the blood. This kind of discoloration is often seen in serious breathing problems, including severe pneumonia. If you notice blue lips or nails during a respiratory illness, it's important to seek medical care right away. Cyanosis is a clear warning that the body is not getting the oxygen it needs, and prompt treatment is critical to correct oxygen levels and address the underlying cause. Confusion or delirium. Next is symptom number 10, confusion or delirium. Feeling mentally foggy, disoriented, or suddenly confused during pneumonia can be frightening. This change in thinking is often linked to the body's inflammatory response to infection. In more severe cases, the immune system releases multiple chemicals to fight the invading pathogens, and those signals can also interfere with normal brain function, contributing to confusion or delirium. Another major factor is oxygen. Pneumonia can reduce the lungs' ability to move oxygen into the blood, and when oxygen levels drop, the brain may not receive enough to function normally. That lack of oxygen can disrupt attention, memory, and awareness, leading to delirium. A 2023 study published in the Journal of Clinical Medicine reported that among patients with severe pneumonia, those who developed delirium faced a significantly higher risk of death than those who did not. This finding highlights why monitoring mental status matters during pneumonia, because recognizing delirium early can be essential for timely intervention. Confusion or delirium should never be treated as a small or harmless symptom. If someone with pneumonia begins to show signs of confusion, it's vital to contact a healthcare professional immediately. Wheezing. Next is symptom number 11, wheezing. Wheezing is that high-pitched whistling sound you may hear when someone breathes in or out. With pneumonia, this can happen when the airways become irritated, swollen, and narrower than normal. The infection doesn't only inflame lung tissue deep inside the chest. It can also affect the bronchial tubes, causing them to tighten and react. When the passageways narrow, air has to squeeze through a smaller space, the airflow becomes turbulent, and that turbulence produces the wheezing sound. Research has also explored how certain infections relate to wheezing patterns. A 2018 study published in Scientific Reports observed that infants with neonatal pneumonia involving co-infection of respiratory syncytial virus together with bacteria, such as Staphylococcus aureus or Klebsiella pneumoniae, were more likely to develop recurrent wheezing episodes later in early childhood. This suggests that specific pathogens may trigger stronger inflammation and increased airway hyperreactivity, raising the chances of wheezing during and after illness. Understanding this link reinforces why early recognition and proper management of pneumonia matter not only for immediate recovery, but also for reducing longer-term breathing problems. If wheezing appears alongside other pneumonia symptoms, medical evaluation should be sought promptly. Muscle pain. Next symptom, number 12, muscle pain. Achy muscles during pneumonia are more common than many people realize. This soreness is largely driven by the immune response. When germs infect the lungs, the immune system releases cytokines to coordinate the attack. While these cytokines help fight the infection, they can also create body-wide inflammation that affects muscles, leading to the deep, sore flu-like discomfort. Muscle aches are especially common in viral pneumonias, including infections caused by influenza, because viruses often trigger a stronger, systemic inflammatory response. That broader reaction can produce more widespread aches and tenderness throughout the body. A 2018 study in the Journal of Cachexia Sarcopenia and Muscle added another layer to this topic by reporting that aspiration pneumonia can contribute to muscle atrophy across multiple muscle groups, including muscles involved in breathing movement and swallowing. The researchers noted that pro-inflammatory cytokines play a central role by activating pathways that accelerate muscle protein breakdown, which can lead to muscle wasting, weakness, and reduced function. So, if you're dealing with pneumonia and notice your muscles feel sore or unusually weak, it reflects how hard your body is working to fight the infection. Recognizing this connection also highlights why supportive care and appropriate rehabilitation during recovery can be important for rebuilding strength and improving overall health. Nausea and vomiting. Feeling sick to your stomach during pneumonia can sound surprising, but it often has a logical explanation. When your body is fighting an infection like pneumonia, it releases a range of immune chemicals to attack the invading pathogens. Those inflammatory signals don't stay limited to the lungs. They can also influence the digestive system, which may trigger nausea and, in some cases, vomiting. Certain forms of pneumonia are more likely to cause these stomach-related symptoms. For example, infections caused by Mycoplasma pneumonia and can present with gastrointestinal complaints along with the more familiar breathing problems. Research also suggests nausea may sometimes point to a more serious illness course. A 2023 study published in the Journal of Clinical Medicine reported that patients with pneumococcal pneumonia who had nausea were more likely to also have bacteria detected in the bloodstream, a condition known as bacteremia. This connection implies that nausea can occasionally be a clue that the infection is more severe. So even though pneumonia is primarily a lung infection, its effects can spread beyond the respiratory system. And that broader impact is why symptoms like nausea and vomiting may appear. Before we wrap up, remember this. Pneumonia doesn't always start with dramatic signs, but your body often gives early warnings. If you notice symptoms like persistent cough fever, shortness of breath, chest pain, confusion, or bluish lips or nails, don't wait, seek medical care promptly. Early action can prevent complications and protect the people you love. If this video helped you, please subscribe to the channel and turn on notifications so you don't miss our next health update.